everyone, I'm Dr. Erin, and today we're going to be answering some top 10 questions that parents most commonly have about their kids' oral health. So number 1, when should you start brushing your kids' teeth, and maybe should they do it on their own? So we highly recommend that maybe around the ages of 6 months onwards, you should start some regular cleaning around the mouth. So even if no obvious teeth have erupted, it's quite a nice habit to begin cleaning the gums just with a soft gauze or a soft cotton wipe, just to get them into that habit of having their mouth cleaned. And definitely once the first tooth starts to erupt, it's very important to start taking care of them, so you can start brushing around at that time. And as to when kids can start brushing their own teeth, I highly recommend that parents supervise or help their kids with the brushing at least until around age 6 or so. So one fun tip that I have heard before is that you should be helping them brush their teeth all the way until they're able to tie their shoelaces on their own. I know it sounds challenging, but that's actually the amount of manual dexterity that they need to be able to get to all the angles and corners of their teeth correctly. So the second question, what kind of toothpaste and toothbrush should my kid be using? For kids, I definitely recommend a smaller toothbrush, smaller head that can fit into their tiny mouths, and just choose one with nice soft bristles so that it feels gentle on their gums and makes them feel comfortable when you're brushing. As for how much toothpaste to use, below the age of 3, I recommend just a very small smear of fluoride toothpaste. So you can look out for a smear amount. If that sounds a little bit hard to understand, is pretty much something like a rice grain. So rice grain amount of toothpaste and smear it on. After the age of 3, once your child knows how to rinse and spit properly, then you can increase that amount of toothpaste to a pea-sized amount of toothpaste. So age 3 is also around when children have all their baby teeth come in, and that's when you really want to make sure that you're keeping all of them really healthy and strong. Question 3, does my child need to floss? Well, that's a great question. So children's teeth are a bit different from adult teeth. They tend to be a little bit more irregular, and plenty of kids have some gaps between their teeth. When there are gaps between the teeth, brushing alone is usually quite sufficient because there will not be as much bacterial plaque lodged between the teeth. Question 4, how often should my child be visiting the dentist? Well, just like for adults, kids are highly encouraged to maintain regular intervals with their visits. I usually recommend around 6 months or so, and this recommendation can differ a little bit depending on maybe how low or how high their risk for certain issues like decay is. Right. Question 5, should I be concerned if I hear my kid grinding their teeth at night? Well, fret not, grinding is actually quite common in kids because their teeth are still developing and their bite is a little bit uneven. But if you notice that this grinding persists into their teenage years, then it's time for us to start considering whether we want to treat that or if there's any other underlying issues we should be aware of. Question 6, well, my kid just has baby teeth. Should I be so concerned about baby teeth, and why do I need to treat them? Well, baby teeth, even though the name says baby, they stay with their kids for a long time, all the way until they're around the ages of 12 to 13. So the kids need these teeth to be able to eat well, speak well, feel confident when they smile. If your child develops decay in their baby teeth that goes untreated, this decay can very easily worsen and cause issues like toothache, which is very uncomfortable to deal with, as well as infection. This infection can even spread to other spaces in the body, such as in the face, and that can potentially be quite life-threatening. So once we spot decay in its initial stages, we really do want to catch it and treat it. Besides that, baby teeth also serve a really important function of holding space in the mouth for the adult teeth to replace them. If a child has decay and they end up losing space because the other teeth start to drift in or the baby tooth is lost, there could be less space in the future for the adult tooth that's waiting to grow out. And that could mean that your kid will end up with more crowding in their mouth that could have been prevented, meaning that they might need other treatment in the future like braces to correct their teeth alignment. Question 7, what should I do if my child complains of having pain in their teeth? Well, pain can come from a lot of reasons, and sometimes children aren't able to really explain that well to us. So I'll definitely recommend scheduling a visit as soon as you're able to. But in the meantime, here are some things that you can try to help them with the pain. First of all, maybe if you're able to spot where the pain is coming from, that could give a good clue. For example, it could be a case of having poor oral hygiene leading to gum inflammation, in which case maybe you can use warm saline rinse, warm salt water rinse to help them soothe that area. You could also try to gently brush or floss. There could be food particles trapped in the gum which is causing them a lot of discomfort. If there's a cavity that's untreated, food lodged into the cavity can be quite uncomfortable as well, and you should try to gently remove the food when you're able to. It would be helpful as well to avoid triggers that could be quite sensitive, such as anything too cold, anything too sweet or sticky, until the problem is addressed. Last of all, if really necessary, please do not hesitate to give your kid any approved over-the-counter analgesics such as Panadol syrup or ibuprofen syrup, just to tide them over until they see a dentist, just as long as you are sure that they can take these medications safely. Question number 8. How do I prevent my kid from having cavities in their teeth? Now, the way I see it, there are two parts to this equation. Number 1 is basically home life. Well, this also includes time that your kid spends at school. This is the majority of time that your kid spends. So this could range from anything to maintaining good habits with regards to their diet, such as making sure that they are taking healthy snacks and healthy family meals, maybe having a good habit of drinking water, to their oral hygiene routine. This could include things like the way in which they're brushing their teeth, what toothpaste you're using, and if there's also perhaps an adult that's supervising them on this journey. So the second part to this equation, is us. I highly recommend regular dental visits. Every 6 months or so is usually quite sufficient. This allows us to check on the status of your child's teeth, if there's any decay. Also allows us to inform you of how their current oral hygiene status is and whether and how you should improve that. Question number 9. Okay, what are dental sealants and does my child need it? Dental sealants is essentially a type of treatment that is considered more preventive. So everyone has grooves in your teeth look like little mountains. And depending on how deep these grooves are or how good your child's oral hygiene is, your dentist might recommend some sealants to protect the teeth. Sealants are preventive treatment because they allow us to seal up the grooves and prevent bacteria from getting trapped in these areas, thereby preventing these areas from developing decay. And depending from child to child, I do usually like to recommend them if I see that the child has poor oral hygiene or their teeth have especially deep grooves. I find that sealants are also really useful once their first adult molars have erupted because these teeth need to stay with them for the rest of their life, and it's really helpful to protect them from a young age. Alright, last question. Are dental x-rays safe for my child? Parents often have lots of concerns about radiation, and I definitely understand why. X-rays are sometimes very important diagnostic tools for us, be it to check on decay, problems in the teeth, or to check on how their development is coming along. Rest assured, we have your child's health in mind when we recommend dental x-rays. I like to assure parents as well that dental x-rays usually have a very, very low dose of radiation. So the equivalent is roughly less than 1 day's worth of background radiation. So that means that you walk around for a whole day and the amount of radiation you're receiving from your environment is a little bit more than the amount of radiation you get from one dental x-ray. Alright, so that's 10 questions answered. If you have any other burning questions, we're always happy to see you here at Dental Designs. See ya!